Thank you for joining me. My name is Ryan Belikoff. Today we're going to talk about low back ergonomic assessments. So this has been broken up into several lectures. So today is more of an introduction. So from this lecture, we should talk about how important back injuries are to almost every sector we have, describe the evaluations methods in the lower back, and really homing in on two assessments, the Nash lifting equation and the Utah back equation, and demonstrate when you would use each one of those and what's our pros and cons. So when we look at risk factors, we've been talking a lot about these. These are all biomechanical. Remember, there is definitely other risk factors, psychosocial. We will talk about psychosocial, but oftentimes it's put on the side because it's so individualistic. But these biomechanicals, such as prolonged standing, so, every year I get people in the military and I think about the drills and the prolonged standing they have, but many sectors have. My wife was in the service field doing as a waitress, and she had to do prolonged standing and has, pretty bad varicose veins. These awkward postures, the person on the top, he's, holding a bag while standing and lifting. Oftentimes, when I give an ergonomic talk as the research being out there, they say, oh, we know that, lifting um, heavy items is bad for the back. However, every time I go out in the field, most sectors are not huge conglomerates, multi-million dollars, that they, have a crew and that they're being as cost effective as possible. And it's the humans that are doing the work and they're taking the toll. These awkward postures, we'll talk about each one of those, pretty much we want it in that power zone, right? In the mid chest, so to the hips there. Anything on the ground or above the head, we need to steer clear from. And then we know that twisting, especially for the back, is not good for the back. Those discs, it compromises them more, acting, squeezing out that sponge, pulling, pushing. These are the factors not often considered. Um, we usually home in on lifting, as we know the stats for overexertion is like 60%. So we usually home in on that, but pushing and pulling with factors in particular definitely an issue. We have talked about these trade-offs with the spine. Spine is a miraculous, it has so many joints, 24 vertebrae, 23 discs, spinal nerves coming out of each of them, lubricated muscles, so many groups of muscles, right? So the trade-off with this mobility, we lose this ability, and that just, equals that increased chances of injury. So we have the range of motion here. So flexion, bending towards your toes, extension, leaning all the way back, looking up toward the ceiling. Uh, we got right and left bending. So I tell people when we're measuring this to put their hand on their leg and bend to the side. We got rotation of the spine turning both ways. So all of those ranges of motion, each part of the spine has a different function. So the lumbar spine more for that flexion and extension, not as good about twisting, just how the vertebrae are oriented really influences. So with these injuries, there's, going to that primary, secondary, and tertiary. Again, the muscles is that primary injury, so that strain, we call it. And there's different levels of that. So, grade 3 is completely torn off the bone, whereas that ligament is the secondary, so we call that a sprain. Similar ratings, 1 through 3, and then we have bone injuries and different classifications of fractures, whether it's an open fracture, a complex fracture. We have green stick. We have all kinds of names for different types of fractures. Disc injuries, we hear a lot about this, but again, only about 10% actually have a prolapse. Most people have a bulge on there. And then we got pinched nerves. So those spinal nerves, remember, we have each divided in half with the motor and the sensory part. Arthritis, at some point, each of us will be affected by arthritis. There's a saying that gravity wins. And so this is very true, getting older and definitely have spots where arthritis has taken hold. Of course, there is genetic factors that cause arthritis to speed up, rheumatoid arthritis, where the body is attacking itself, attacking the bones, causing this arthritis. So there's lots of ways that injuries impact us, especially the workers. When we talk about pain, very subjective. Usually when we go in the ask, they go 0 to 10 or have those smiley faces versus the frown faces. But remember, the worst pain is what you're experiencing because no one else is experiencing that pain. There's definitely been a lot of studies about, as a whole, what kind of injuries produce most pain, and sciatica, so pinching that nerve going down the leg from the back, is number 2. So number 1, they say kidney stones is the worst pain that a person's ever experienced. Of course, there's childbirth in there, and a big part of that stat, obviously males don't experience that, so that's probably why it's not number 1. But kidney stones is for the whole population, listed as one. For medical costs, for back injuries, very expensive because they take so long. And really, there's not good treatments. Back surgeries are about $80,000 a year now. Time loss of wages. Usually, they say if a person doesn't come back to work within 6 months, they're not going back to that job. And that's pretty accurate, less than 1%. So we need to get these people back to work and try to figure out disability. So there's temporary and then permanent disability. That's what the PD stands for. And then, being also a chiropractor as well as a researcher, I've treated tens of thousands of back injuries. And when they have these injuries, it affects more than just their body. Their whole family structure is usually influenced. I mean, number 1 is money coming in. So even though they have workers' comp coming in, the states that I worked in, it was reduced. They were only getting 70% of their wage. Not to mention that they had a lot of anxiety about whether they're going back to that job, all these medical visits that they have to do. And then it affects, other social activities. Usually, the things that keep them healthy and active. I like to bike, but that's extremely difficult with back pain. People experience, back pain in a number of ways, and it influences their whole life. So, as an industrial hygienist or a safety professional, it's extremely important to have tools to evaluate these spinal injuries and assessments. So, number 1 is posture. So, the direction, range of motion is very important. That's often restricted with range of motion because the muscles are restricting you, they're trying to protect you. Often at times, I say there's this vicious cycle that the muscles spasm, splinting, trying to protect you, but that pushes more pressure on that nerve, especially in the back. Other things like whiplash. So if there's injuries that the muscle spasms, you lose that curve. And if you looked at X-ray, that curve, instead of going, a nice curve, it would be up and down, straight as board. So actually lifting the load, so we got endogenous, so that's just lifting your body part yourself. So if you're bending down, remember you're lifting your whole upper body, and then exogenous is just lifting whatever item you're lifting. And then time dynamic versus static. We've talked about how sitting is bad for us because of the static load. It doesn't allow those nutrients to come in or go away. Dynamic stresses, we also can be bad if it's repetitive enough. It causes inflammation. Reach distance from the spine. So when we go off the Nash lifting equation, the reach, the distance from the middle of the spine is so important. Just as engineering how the numbers work out for the compression pain. It can be qualitative, but we say sometimes it's quantitative when we say 0 to 10. There's different tools we'll introduce that you can measure. Again, that mobility, we've gone over range of motion with the lumbar spine, for example, flexion, extension, range of motion, or rotation, lateral flexion, but speed is also important, that acceleration. So if we have real-time sensors or low back motion monitor, it can measure that acceleration and that direction. Tenderness, this is more of a physical therapy slash chiropractic deal. So when you touch someone and they wince and they're like, oh, it hurts right there, then you can rate based on that clinician. There's a scale. So +2 is the normal toneness, but if it was a spasm incomplete, it was probably a +3. Whereas if it's very flaccid, no muscle tonus at all, it's a 0. So those are kind of the scales for tenderness, but there's this algorithmetry, which we have a pressure gauge based on the pressure that causes their pain. So it can be very beneficial for diagnosing like fibromyalgia. They'll say there's so many trigger points, like 12 trigger points. So each one of those with a certain amount of pressure produces pain to help that diagnosis. And then muscle activity, we've gone over spasms, but there's the EMGs, which we can have little sensors connecting how much muscle activity is going on. And so that's usually measured at 50% of that muscle load. So we estimate that 100%, and then those sensors gauge from the 50% and calculate how many muscle fibers are actually initiating based on that first evaluation. Strength, lots of ways to evaluate strength. There's force plates and there's other evaluation tools. I feel if you're learning ergonomics or haven't done ergonomics in a while, this NIOSH Elements of Ergonomic Programs gives a good starting point. So here's a checklist. So we could start with, is there lifting of the loads or the parts? And so then you kind of know which equation you should be thinking. Is this a NIOSH lifting equation, or is this more of a REBA type of thing, more based on posture? Is there a lowering of tools so we know concentric, like a flexion, like a bending a dumbbell, is less hazard than eccentric, where we're slowly lowering, like extending that load, and which could cause 3 times more risk. Is there overhead reaching? So we know from overhead reach can be at least 80% of our ability to lift. So overhead. Is there bending, twisting? We know those are bad for us. So that's a good start. Of all those checklists, we can incorporate to know if there's a problem. So if we go into further of the NIOSH elements of ergonomic programs, that they have tables. So they often list the duration you're doing the activity in 3 different categories of never, sometimes, and usually. So are they lifting? Are they using hand tools? Are they sitting? Up here it says what is usually. So if a worker is supposed to a condition 3 or more times daily, seems though on the cautious side. However, it has good research on here. And then, with material handling, more characteristic of that industry that is the work surface level? Is it smooth? If a number of you have gone into the mine now, those trip hazards with those little rocks sticking out. So that's probably unique to that area. Um, or is there proper footwear? So we know different footwear for different atmospheres. So if you're working in a kitchen versus on the construction site, we know we want different types of footwear. For that material handling, again, that static load, are they holding it for a period of time? More of that uh, job sector, are they doing job rotation? Is it self-paced? Do they get to decide where they get to go? All these factors. So Dr. Bernard from the University of California has adopted tools that already exist, such as this one on the Liberty Mutual tables. And so creating Excels, so you could just input your data without doing the worksheet and know pretty quickly. So, Liberty doesn't come from Dr. Bernard, but he has a number of them. So this next one is dynamic work. And so this is very similar to a project that I worked on with was a fatigue analysis tool. But what I liked about it is most tasks are not just simple tasks, even though they're lifting, yes, from the, ground to the up above. Usually they're also twisting and putting something on the side, grabbing some bolts, what have you, or, having to restock all within that 2 minutes. And so this is ability to, evaluate more than just one simple task, usually putting 7 to 9 tasks in one state. And then other, not from Dr. Bernard, using these Liberty Mutual tables. So we do have, the fatigue, but this one goes into the lifting with the percent of female versus male, getting into that 5 percentile versus that 95th percentile for each one of the male versus female. And then I like this example. My friend in high school, I was digging ditches. He was a cart boy, but he always complained about pains in his shoulders and how the union would take out more money, so he was making less money from me. But just goes to show that pushing can be just as hazardous as lifting. So this is a tool looking at, static loads. So at least 50% of the workplaces I go to do evaluations, they don't allow them to have a seat or a stool. So they're standing all day. So this is looking at how long they're standing with their maximum force by that percentile they're doing. So just other tool you could use to help evaluate this endurance and um, possible risk. So TLV, so I hope you all have a TLV book. If you don't, as a student, you can ask the ICGIH, sign up as a student member, and you can get a free TLV book. So for lifting, there is some screening tools they have looking at, so for lifting frequency, if they're lifting more than 160 lifts per hour, so that seems pretty high, right? Lifting tasks performed longer than 8 hours per day. Again, most of the evaluation tools you'll see even left high risk at 4, but a lot of factors go into play. Are they twisting more than 30 degrees? With modifiers like Nash lifting equation, you'll definitely see that 30 degrees is a high risk. Are they doing one-handed? How they are lifting? Does the tool have handles on it? Um, Again, some tools are not made for one-handed lifts. So like Nash lifting equation is not good for a one-handed lift. So looking at this standard screening limit, they list it in three different categories of infrequent, intermediate, and frequent. So take a look at these. So infrequent, they're saying less than 2 hours a day or less than 120 lifts a day, whereas the intermediate lift would be more than 2 hours at 30 lifts per hour. And then frequent, more than 2 hours, but less than 360 lifts per hour. So just get familiar with those. On the right side, we see the lower screening limits. So Reba and Rula, so we did Rula with the upper extremity. So we'll get to this Reba. So this is the entire body. So this is a tool you can use to evaluate the back as well. Knowledge lifting equation, probably the most popular of the lower back assessments. It has been around for a long time, since 81, revised in 93. Again, that there's some other revisions in the 2000s, but not that many changes. As you can see, you'll want to look at the lift, and then there's modifiers. So far as the load, horizontal, vertical, distance, asymmetry, meaning are you rotating, the duration you're lifting, and the frequency. And then the last one is how good your handling is. So we'll go through that more in detail. The one shown is actually an Excel spreadsheet, so you could just put in the numbers, even though we'll do it the long way with the tables with a NIOSH lifting equation, so you could appreciate some of these tools. This is from North Carolina, I believe, that did this Excel spreadsheet. And then at the end, it will give a lifting index to categories if it's acceptable, or in the red, unacceptable, or yellow, it should be addressed. So other tool we'll look at more closely is the Utah back compressive model. And so this is by Dr. Boswick from the University of Utah. And so very similar to the NIOSH lifting equation, but it gives some personal measurements, such as what is the weight of the worker to be added into these compressive forces. And so again, Dr. Bernard created an Excel spreadsheet from Florida from Dr. Bosworth's work, so you could just input the measurements and know the compressive forces. And now, I mean, we have much better sensors, but things are getting smaller with phones. So the, top EMG sensors, we want them parallel to the body. Again, they're measuring how much muscle initiation for is occurring. In the middle there is Dr. Gilkey with Xsense. So I use this as a project with bed height. So at that time, this is an older version. It was $80,000. They have a newer version over $100,000. But what's cool is that they also use it in the movies. So using that body movement in real time, you could see the body moving. So I think of some of those like oh, sorry, Planet of the Apes, for example. The apes are actually humans, and they put apes' bodies into these, but the people are actually moving. So it's pretty wild. And so Dr. Gilkey, again, using the LLM monitor, lumbar motion monitor. This is from Bill Maris. He's at Utah. Uh, Utah State University, been, in the field for low back research for many decades, has contributed quite a bit. One of these advantages, and so this is, over 20 years old, but it incorporated an acceleration to those movements, as well as created a database with a number of work sectors of what kind of forces were occurring in the back. So other tool that definitely have used the Ergo Master or this two-dimensional. So you put in the patient's or subject's height, and then you click on these circles identifying different landmarks, such as the middle of the ear, the middle of the hip, the middle of the knee, on the side, and you go through each one of those, and it takes you through what is the load being lifted, and then it calculates based on that posture, that snapshot of what is the compressive forces. So this is a tool from NextGen. Unfortunately, I want to slaughter his name. Provinsky is his name, ergonomics. So it's a really nifty tool. So again, this is, even though it looks old, this low back monitor from Dr. Maris. So these are some of the outputs that it's going to give you, the degrees. So it has steel cables trying to measure what is the velocity as you bend down and the acceleration. So this data point, he had over 50 work sectors, so a huge database of data collection that he gave us. So mixing and matching tools. So this is a great one that gets us to more where we're at now. So, starting with video recording the tasks, putting those clips in, identifying the joint postures that are high risk or lifting, and then putting them into analysis tools like Reba, Rula, those type of things to get evaluation. So mixing and matching. And then we got the 2D and 3D. So this was from the University of Michigan. So there's a new company that actually bought them, but University of Michigan has a big ergonomics program that's linked to their engineering department. So it's really large. But the good thing is you position the person's body according to how you see their lift, rearrange in this body range, and then it will give a percentile for that lift for each one of those body ranges. So the low back as well as the wrist and the shoulder. And so you could compare it to a female at 90 percentile versus 5 percentile. So giving it a little bit more personal factors than this. Please go to these tools that Dr. Bernard has done, a wealth of work at trying to create these Excel spreadsheets so we could readily use this, as well as North Carolina has free accessible ones that you can use. So hopefully at the end of this, you can identify, impacts of back injuries, what kind of tools are out there to use to assess lower back risk assessments with ergonomics, and know the two big ones with Nash lifting equation and the Utah back modeling equation. All right. With that, thank you.